Kazambo, I'm Chunizuk Selden. Today we come to you from Lemurden in Paro, and I am here to discuss a very important topic, mental health. And I'm joined by Dr. Andrea Bruni, who is the Regional Advisor for Mental Health for Southeast Asian Region, WHO. He's here to attend the 75th session of the WHO Regional Committee for Southeast Asia that's being held in Paro here. So thank you so much for taking this time to join us and talk about mental health. So my first question, the obvious question, is why is mental health so important?
Thank you very much. Thank you for the invite. I'm very glad to be here and happy to be in Bhutan. It is very important to talk about mental health for many reasons. The first one is that mental conditions are highly prevalent. Mental, neurological, and substance use disorders are extremely prevalent worldwide, and there's no country that is exception to that. Globally, it is estimated that roughly the prevalence of mental conditions is roughly 13%. So that is a very good reason to talk about mental health and to give priority to mental health interventions and transformation in mental health, to reform mental health services, to set up community-based networks which are available to people.
I see. And especially with the pandemic, I think it has only made the situation worse. So how is WHO approaching this now?
The pandemic has been very tough for all of us, and we have evidence that several mental conditions have increased. Imagine that the prevalence of anxiety and depression has gone up of roughly 25%. And also other conditions have become much more prevalent, including neurological conditions. And the reason for this is because many stressors have been added to the pre-existing stressors. Stressors related not only to COVID itself and the fear of the virus, but also sometimes on the restrictions that were implemented. So all of this has generated an increase of mental conditions, but also the clarity that there is an urgent need to address mental health in countries.
And I think you mentioned that the ministerial roundtable this year is focusing on mental health. I think this comes at the right time.
This ministerial roundtable on mental health is very timely. The focus is on primary health care and community engagement, which are two main areas to be tackled in mental health. Community engagement is fundamental, and mental health services should also be implemented at community level. Mental health services should be made available in communities where people live and should be acceptable and accessible to everyone in order to achieve universal health coverage. And primary health care is also a very important strategy to reduce the treatment gap, which is very high in many countries. In several countries in the Southeast Asian region, we know that the treatment gap ranges between 75 and 95%, meaning, in other words, that 95% of people suffering from some mental condition are not receiving appropriate, timely treatment and care.
Okay, and those are big numbers.
Those are huge numbers. That's a huge proportion of.
So how do we work to make sure I think, have already actually mentioned that we, earlier before we even started recording this, you mentioned something about task shifting. I think that's an answer to how we can tackle the gap.
Yes. Many countries are working, the majority of countries are working on the integration of mental health into primary health care. And a fundamental mechanism there is task shifting. In other words, we should leverage on the health workforce existing in countries, not necessarily on specialized health professionals, but we can count on general practitioners, family doctors, general nurses to deliver some basic packages of interventions. And WHO has a program which is known as the MHGAP program, the Mental Health Gap Action Program, which is entirely designed to integrate mental health into primary health care. This is very important because countries will not be able to reduce this treatment gap only through specialized workforce. In the case of Bhutan, we have data indicating that there is only 0.5 psychiatrists per 100,000 population and only 1.2 psychiatric nurses per 100,000 population. So with these numbers, of course, we need to leverage, again, on general health workers.
True. Wow, those numbers are it's shocking. And I think the fact that you mentioned that it is important to do the task shifting and to the primary health care givers, I think it will help address that issue of the gap.
Yeah, implementing that, it's fundamental to help reduce the treatment gap and bring support, treatment and care in communities where treatment is needed.
To an expert, how does the mental health situation in Bhutan appear? How does it look?
So Bhutan has made some very good progress in mental health and has also given a lot of priority to this area, which very often is forgotten. First of all, in Bhutan, the PEMA initiative was established. PEMA is an institution for enhancing mental health services, which was instituted by Her Majesty the Queen. Also, Bhutan is equipped with a mental health policy, which is something that WHO very often recommends countries, and this policy was launched in 1997. Bhutan is also in the process of preparing a new general health law, so it will be very important for Bhutan to incorporate a good mental health component in the overall health legislation. Bhutan has also done progress in terms of services, mainly in the integration of mental health into primary health care, but has also worked hard during COVID-19 in terms of promotion and prevention of mental health and in making available a set of annual data on mental health, which is also a very common challenge.
So as you know, Bhutan is a country driven by the philosophy of G&H. And I want to ask you this. Do you think Bhutan places enough importance on mental health, given that we place so much importance on gross national happiness?
Well, I think that happiness is very closely related to well-being and mental health. So in this sense, this is a very important indicator of the importance that Bhutan is attaching to happiness, well-being, and mental health. When we think of mental health, well-being, and mental disorders, we need to think of them as a continuum. So there's no people that is entirely free from mental suffering. We all experience at some point in life some forms of mental suffering, or someone who is completely impaired because of their mental conditions. Now, what is important is to work to reduce risk factors and improve the well-being of people through prevention of mental disorders.
I see. And talking about the efforts that a country has to put in to improve the mental health of its people, what are some progress that WHO has made in Bhutan?
So, as I mentioned earlier, one very important aspect was to, in terms of leadership and governance, was to support the development of the mental health policy in 1997, but also to support in terms of services, the integration of mental health into primary health care. Again, a lot of effort was put during COVID-19 in terms of prevention and promotion of mental health, which was very instrumental to reduce stress, anxiety, and any forms of mental reactions and conditions in the population. These are all very good progress that have been made.
And talking about progress, we cannot talk about progress without talking about challenges. So what are some challenges?
Well, challenges that are very common in mental health start from stigma and discrimination. This is a phenomenon that unfortunately is very common everywhere globally. And stigma is very common against people with mental disorders, but also their family members, and also health professionals that are dealing with people with mental conditions. Stigma is extremely pronounced against people with severe mental conditions, such as, for example, psychosis, and schizophrenia is a form of psychosis, or bipolar disorder. And we have evidence that people with severe mental disorders die from 10 to 20 years earlier than the general population. And the reason for that is also due to stigma and discrimination, because people with severe mental conditions very often are denied health services. So a lot of this mortality is to be attributed to non-communicable diseases that can be easily prevented and treated, but people with severe mental conditions are denied treatment and care. And this is an obvious example of stigma and discrimination.
So how can we address this? Because it sounds quite deep-rooted, and a lot of it is cultural too, and lack of awareness. So how can WHO help in addressing this?
Of course, this is related to many aspects. There are many aspects affecting stigma and discrimination. After all, stigma is a way of thinking, right? But the way of thinking, even in cultures, is something that can change and can be improved. One way, obviously, is to work together very closely with people with lived experience. They have a lot to contribute to mental health, starting from designing mental health policies, plans, legislations, which are fundamental to protect the rights of people with mental conditions and disability, but also to design services and so on and so forth. So they are a key player in any intervention that has to do with mental health. It's also very important to provide services that are more acceptable. In other words, mental health historically has been very often centered at psychiatric hospital center, at psychiatric hospitals, at asylums, and these are often long-stay institutions which are attached with a lot of stigma. It's very important to move away from this kind of institutions and to establish community-based networks, which are, again, based in the community, obviously, which is where people live. And also to work closely, once again, with primary healthcare, because these facilities and these services help reduce the stigma which is associated with mental health, and also help put mental health on the same level as physical health.
True, like other illnesses.
Exactly.
Earlier, when we were talking, you mentioned something about how globally countries don't invest enough into mental health. If you could talk a little more about it.
Underinvestment is very common in many countries in mental health, and there's a number of countries that invest 2% only of the overall health budget, or even less than that. And that is a very small percentage, is a very small proportion of the budget that is dedicated to mental health, considering that it is estimated that mental conditions, the prevalence of mental conditions is roughly 13%. Then this is a very scanty percentage of the overall health budget that is spent in mental health. So definitely one important transition is to move away from an underinvestment scenario to a sufficient, adequate and targeted investment in mental health.
And I think this goes to, if that is not addressed, if underinvestment, as you said, is prevalent, that is where the treatment gap come. Am I right?
Yeah, obviously financial resources are needed to address the treatment gap and to provide the needed services. So there is obvious need in many countries to invest more in mental health, not only more, but also to invest in community-based interventions, because very often long-stay institutions, psychiatric hospitals and asylums absorb an important proportion of the small mental health budget which is made available for mental health services.
And how can we convince the countries to increase their budget for mental health? Because it is evident, especially with the statistics that you gave us, how mental health is prevalent across borders, across cultures, and across all socio-economic classes. So it is something that a lot of the people deal with, yet the government isn't convinced enough to invest in it. So how do we go about that? How do we make it urgent?
Well, nowadays we have a lot of evidence which is made available that shows the prevalence of these mental conditions, but also the burden that mental conditions generate on people, not only individuals, but also families, communities, and society, the impact that mental conditions have on economic growth. But also there is a moral argument. It's very important to provide the treatment and care that people need in their communities. So I think the evidence is there and the data is available. It's important to have high-level advocacy to share this kind of information, but also to share that there are effective programs that can tackle these mental conditions. So it makes sense to invest in mental health. And after COVID-19 started, that makes additional sense, because we know that the prevalence of mental conditions have even increased after the beginning of the pandemics. So there are all reasons to invest more in mental health.
You've beautifully drawn this connection between mental health and economic growth. And I remember you earlier mentioned how there's this connection between climate change and mental health too. So if you could elaborate a little on that.
Yes, climate change and mental health are very closely related, and climate change can severely affect the mental health of populations. So it's extremely important to always include a mental health component in every action that is taken to address climate change. Any policy, any program should always integrate a mental health component.
And why is that?
Because mental health has to be mainstreamed, because climate change will definitely impact greatly the mental health of population, not only in increasing mental conditions and mental disorders, but also there is evidence that climate change can increase the number of suicides in countries. So as I mentioned earlier, one very important transition is to move from underinvestment in mental health towards sufficient, adequate, and targeted investment in mental health. Another important transition is to move away from a custodial type of mental health, which very often is based at psychiatric hospitals, asylums, and long-stay institutions, towards community-based mental health networks and primary health care. So it's very important for countries to set up community-based mental health services which are accessible to people, but also to integrate mental health into primary health care through task shifting.
Thank you so much. I want to thank Dr. Andrea Bruni for taking this time out of your very busy schedule here. And I appreciate you sharing us your insights on mental health and giving us your time. So thank you so much.
Thank you so much. It's my pleasure to be here. Thank you for the invite. Kadinche.
Honor's ours. So thank you so much for watching. We'll catch you next time. Bye.